For just a couple of minutes, I want to talk about some of the clinical problems that you might have in your life when it comes to problems with some of the nerve plexuses in your neck and in your shoulder and in your low back. And these are just common problems that all men and women will face in their life. I know that in the cervical plexus you have the phrenic nerve which controls the diaphragm, but that's really not a big clinical importance. Here's what I see though. When people get struck from behind, when they get in an automobile vehicle accident, the discs in the low neck, we're talking about the C5, C6, C7, C8, we're talking about these different nerve roots, T1, that are affected in an automobile vehicle accident. The nerves, the median nerve goes down to innervate these fingers. Radian, radial, radian goes down kind of to the middle, and then ulnar is to the medial aspect of the arm. And so a lot of times when a person gets a whiplash injury, it affects the discs in the low neck, and so it causes numbness and tingling down the arms and hands. This is really common in a lot of people that have automobile vehicle accidents. You may struggle with this unless you get it treated. Sometimes it's treated medicinally, sometimes chiropractic, physical therapy, and so forth. In the low back, there are nerves, the femoral and obturator nerves innervate the inside of the thigh. So sometimes when I have people that come into my office that have problems in the upper lumbar, they will complain about bizarre sensations on the inside of their thigh. If the problem in their back is lower, right down in L5, S1, S2 area right in here, then it will usually affect the sciatic nerve that goes down the leg, and they may have numbness or tingling in their feet. And if it is really progressive, they could actually have a foot drop, because the nerves that allow you to pick your foot up every step that you take can be affected with a low back problem, so that a person can drag their foot on the ground. And it's called a steppage gait, where a person will actually do something like this they're a little bit more fluid than that. I know that's kind of ratchety looking, but I've understood that about 80% of all people in their lifetime will have low back pain. So problems with the brachial plexus that cause problems down the arm can even radiate pain into the chest and mimic other problems. Also problems in the low back that go down to the leg and to the foot, and it can cause anything from pain, numbness. These are very, very common to the human frame, and the disc in the low back specifically and in the low neck specifically, both of these discs are at risk because they go from an area of high stability in the hips to not a lot of stability in the lumbar, and then a lot of stability in the thoracic with all the ribs reinforcing, to an area in the neck where there's not a lot of reinforcement. So these low discs, C6, C7, L5, S1 area, those are the ones that are at risk in humans. I love the use of ice, because ice, cold, a gel pack wrapped in a dish towel is perfect, because this can start getting rid of some of the inflammation. And chiropractic is really good at helping with these things. Sometimes it's slow, it doesn't happen, it's not a miracle usually, but these are some common problems in the human frame that I thought you might benefit from me talking about.